our 2012 webinar series. Today we're going to be talking about achievement advocacy for Asperger students. Before I get started, I just wanted to mention that everyone will be muted throughout the webinar. This is so we can hear everyone more clearly, but also improve the recording. When you do have a question, there is a question box. Please feel free to put in questions throughout the webinar. However, Deanne and Karen will not answer the questions until the very end. So please be patient if your question doesn't get answered right away. As I said, the webinar will be recorded and available for download at schoolcounselor.org. Now I'd like to introduce you to the speakers. First we have Karen Rowland, who is currently working as an assistant professor in school in clinical mental health counseling programs at Mercer University in the College of Continuing Professional Studies. Dr. Rowland received her undergraduate and master's degree in elementary education and counselor education from the University of Maine, and her PhD in counselor education from the University of South Carolina. Dr. Rowland has published several peer-reviewed manuscripts represented at numerous professional conferences in the United States and the Bahamas. Dr. Rowland's expertise is in school counselor preparation with an interest in career and multicultural counseling, multicultural supervision, counselor supervision, and mental health issues in the school setting. Dr. Rowland is a licensed professional counselor, a professional counselor supervisor, and a certified school counselor for the state of Georgia and a nationally certified counselor. And also we have Deanne Unsworth Fleming, and she is an elementary school counselor in Clayton County, Georgia. She works in a Title I school, drawing from her own personal expertise with poverty and advocacy for children and families, and promoting the fact that education is one way out of generational poverty. She is the parent of a son that's diagnosed with Asperger's disorder, which her family doesn't view as a disorder, but as a superpower. So I'll pass it on to Karen and Deanne.
Well, good afternoon, and welcome to our webinar on working effectively with students diagnosed with Asperger's. As Jeff said, I'm Karen Rowland, and I'll be presenting along with Deanne Fleming. Let me first begin by sharing a little bit about my experience with Asperger's. And believe you me, it's very limited. My experience with Asperger's happened when Asperger's apparently was not the diagnosis of choice for schools. And this was during the early and mid-90s. The buzzword then for diagnosis was either ADD or ADHD. Students today who would be diagnosed with Asperger's at that time was simply labeled as strange, odd, or weird if they were not hyper or didn't have a problem with focusing. Now, Deanne will share briefly her experience, and just briefly since her experience is still ongoing.
Good afternoon. My experience with Asperger's began about 15 years ago when I had a son who at the time was 4 and was not speaking, but had a 1-year-old who was singing her ABCs. So the pediatrician referred us to a specialist, and he said to me, I need you to think about autism. And at that moment, it felt like I had been punched in the stomach. But that's when my journey began. My son is now a senior, and since that time, I have become a school counselor and had the privilege of working with many students and families and teachers in my schools with Asperger's.
Thank you, Deanne. I know that many of you have questions for Deanne later on, so I'd like to start by reminding you to refer to the PowerPoint slides we've uploaded for you. These certainly will help in answering the questions. We've also created a little test that you may respond to. The format that we will use is we're going to speak for about 40 to 45 minutes, and then the last 20 to 15 minutes allow you to ask questions. If we can begin. Just want to give a brief description. See if you may know this child. His name is Abe. 10-year-old student, loves math and is good at it, but he struggles in language arts. Has a fascination with spaceships and gives long, detailed descriptions of how the engines work. He seems more interested in playing with things rather than with people. When he is with people, Abe often misreads social cues, almost like he cannot understand the nonverbal behaviors. He expresses emotions, but often not in appropriate ways or at appropriate times. Sharing and taking turns is extremely difficult for him. Make-believe games are nearly impossible. He does not seem to understand the rules of these types of activities. Physical activities, he seems to be clumsy and has an unusual stance, sometimes walking or running on his toes. Teachers often remark that he is just different or a bit odd, similar to what I've heard in my experience when I used to be a school counselor. Just to give you briefly some of the signs and symptoms of Asperger's before we move right on into the role of being an advocate for students with this diagnosis in the school, and then some of the interventions that's possible that can be done in a school setting. Some of the signs and symptoms of Asperger's include engaging in one-sided, long-winded conversations without noticing if the listener is actually listening or trying to change the subject. Displaying unusual nonverbal communication, such as lack of eye contact, few facial expression, or awkward body postures and gestures. Showing an intense obsession with one or two specific narrow subjects. Could be baseball, stats, trains, etc. Appearing not to understand, empathize with, or be sensitive to others' feelings. Having a hard time reading other people, understanding, or even understanding humor. Speaking in a voice that is monotonous, rigid, unusually fast. Moving clumsily with poor coordination, and having an odd posture or rigid gait. Like I said, it's a brief description of some of the signs, some of the symptoms of a student that may be diagnosed as being having Asperger's. So Deanna is going to move right into, and you will notice we're kind of skipping some of the slides, and that's to give you opportunity to go back and read at your leisure to understand a little bit more about it, but we want to get right into the role of advocacy. So Deanne will cover that.
So the role of the school counselor. Academically, these children usually do quite well, but they lack the emotional resources to cope with many of the demands of the classroom. It's important for schools to recognize that the child has an inherent developmental disorder that causes him or her to behave and respond in a different way from other students. School counselors must be prepared to encourage teachers to use charts, pictures to help the child visualize the day, and to also always prepare him or her for any changes in advance, especially like if there's going to be a substitute teacher in the building, giving those kids heads up, giving the substitute heads up is one way that a school counselor can really help. Also, the visualizing charts with pictures, like I said, for what is happening in the day. And sometimes there's changes, so always giving those kids a heads up to any changes that may come as much as you can is possible. Emphasize the need to avoid power struggles, since children with Asperger's often become more rigid and stubborn if confronted or forced. School counselors may offer the following suggestions to teachers for the classroom. In order to prevent those outbursts and power struggles, provide a very consistent environment, and like I said before, preparing the child whenever possible for any changes in the routine, because that is so important. When their routine is messed up, they can become very rigid and not be flexible. Suggest ways for helping a student stay focused by possibly placing a child in the front of the room where the teacher can subtly signal to the student when he or she is off task, and consulting with the student about what signal to use, because they often are very, very smart and often have suggestions themselves. They can understand themselves quite well and may know what's best for them. Collaborate with teachers with ways to help reduce anxiety in the classroom. Allowing the student maybe to use a stress ball or to stand up while doing their work can often be helpful and help them focus, relieve anxiety. Suggesting maybe a peer buddy to accompany the student while changing classes to help reduce stress from the noise and the people in the hallway. Sometimes a peer buddy may be really beneficial. Sometimes it may not work so well because often students with Asperger's are very parentified, and it's difficult for them to work collaboratively with another student. They kind of see themselves as the expert in things, and they may not want to follow the direction of a peer. So that's something that has to, you have to think about that ahead of time for a peer buddy and work on that. So another suggestion maybe is to switch classes, especially middle and high school. Maybe switching, writing into the IEP or working with teachers and scheduling to maybe have the child move 5 minutes early or 5 minutes later, because those hallways with all those kids and noises and bells and things can be very disturbing for a child who has this disorder. So it's just important to be really flexible because kids with Asperger's are as different as they are similar, and there's no one set of rules or strategies that's going to work for everyone. Another thing to think about is the lunchroom, because that can be an extremely stressful situation for these kids. I know at my son's school, his caseworker actually worked out a deal so that she'll monitor that hallway at lunchtime if her Asperger's kids could eat lunch in her office with her where it's quiet and calm. I know one day when she wasn't at school, he had told me he ate lunch in the hallway because the lunchroom is just not someplace he ever wants to go. So that's just something, to think about as a person in the building to advocate for these kids. Teaching a student how to cope when overwhelmed, like writing a list on note cards that they could keep in their pocket. They're very concrete things that they can do to calm down. For example, like taking deep breaths, counting on their fingers, asking to see the counselor. And also maybe using one of their ritualized behaviors that they find comforting. Spinning is often very comforting to them, spinning objects, spinning things, which usually is not okay to occur in the classroom. So I know one thing that has worked in the past is like a yo-yo. Is something that they can just go, do for a little while, chill out, and that can help them. Also having a room. At my son's school, it's not necessarily the counselor but the caseworker, but, they work together to have a room for, a sensory room where these kids can go just to calm down, because all the lights, all the noise, all the kids makes for a very stressful day when they're having to endure that all day. You also have to teach the obvious. Like when you're smiling, teach the child that this usually means you're happy. They don't always know that. Be calm, predictable, matter of fact, while remaining sensitive and caring. Don't expect the child to know how you're feeling. In the same way he can't perceive the feelings of others, they're often unaware of their own emotions. So those are things that need to be taught. Also, being alert to changes in behavior that may indicate depression, such as increased frustration, chronic fatigue, extreme inattentiveness. They'll often say they're okay, but their behavior is often more accurate of their true feelings. And especially for those of you working in middle school, that can often be a very, very difficult time. Sometimes these kids are not even diagnosed up until then, because at that level they just kind of hit a wall and things can become much more difficult. I know there was an instance with my son. I knew there was something wrong and something not right, but I couldn't he couldn't verbalize it to me, and I really couldn't get at it. One day we were in karate, and I had asked him to change his shirt into another t-shirt, which he did willingly, but that shirt had not been washed, and all of a sudden he just freaked out. Typically it would have been something he could have handled, but he just totally lost it, ripped the shirt off, was screaming. No one there had seen him act like that, and it was at that time that I knew there was something definitely going on, and that we needed to do something, and it was school. So that was the key to me, that it was time to do something. So you got to keep an eye on these kids' behavior. They often can't verbalize really what's going on. Adolescents with Asperger's are prone to depression, so it's very important to respond quickly to difficulties. And children with Asperger's are easily overwhelmed, like I've mentioned before, and react more severely to failure than other children, and more severely just to other situations that other kids just, it rolls right off their back. School personnel need to be in a position to provide appropriate and effective support and accommodations to students with Asperger's, and it's often very helpful for a school counselor to take a leadership role in that. You're often the ones who really know what's going on and understand the disorder better than others. So facilitating collaboration among the school personnel to present effective and best practices in like social and behavioral support, sensory accommodations, academic planning, and programming, often sitting in on IEPs to get them what they need. So best practices for these kids. The causes. Doctors and researchers don't understand exactly what causes it, although there seems to be a strong genetic component. And it also seems to be linked to structural abnormalities in several regions of the brain. All kids have their quirks. Toddlers show a sign or symptom of Asperger's syndrome at some point. Everybody, may have a little bit of this in them. And it's natural for small children to be egocentric. And many show a strong interest in a particular topic, such as dinosaurs or favorite fictional characters. And those things in and of themselves are not reasons to be alarmed. It's when they all occur together, and it's all about volume control. So when it's a lot of all of them together. However, if elementary school children have frequent problems in school, unable to make friends, a good recommendation is to ask the parents to consult with the child's pediatrician. These difficulties have many possible causes, but developmental disorders such as Asperger's shouldn't be ruled out. And children whose eccentricities interfere with learning and social development should have a comprehensive evaluation. Because Asperger's disorder varies widely in severity and signs, like I mentioned before, all the kids are different. Making a diagnosis can be difficult. And if the child shows some signs of Asperger's, a comprehensive assessment by a team of professionals is the suggested method to use for accurate diagnosis. Now that evaluation will most likely include observing the child, talking to the parents about the development, questionnaires for teachers and parents, asking about the child's social interaction, communication skills, friendships, and facilitating the process of having the child undergo a number of tests to determine his or her level of intellectual and academic abilities. The test may assess the child's abilities in the areas of speech, language, visual motor problem solving. The test can also identify other emotional, behavioral, and psychological issues. Unfortunately, some kids with Asperger's are first misdiagnosed with another problem, such as attention deficit hyperactivity disorder, ADHD, or an emotional behavior disorder, oftentimes even a specific learning disability. Even worse, some of these students with undiagnosed Asperger's are labeled by both teachers and students alike as willful or malicious troublemakers. I know there was an instance in elementary school where my son was in the restroom, and a teacher came in and told him he needed to go to his class, and he said, "You're not my teacher." Now, that was just a statement of fact for him, and the teacher took it as being disrespectful and rude, and he was sent to the office. And to this day, he can't understand for the life of him why that statement of fact and truth would be considered to be disrespectful. So they're often, seen as troublemakers when in fact they are not. And that's why it's important to conduct an assessment if the child's having difficulties at school. Now, Karen is going to provide more information on best practices.
All right, including some of the information that Deanne has already shared with you, I think it's important for us to know and to state that the core signs of Asperger's really cannot be cured. Most children benefit from early specialized interventions that focus on behavior management and social skills training. And the research has actually shown that. And some of the options in these training usually include communication and social skills training, as well as cognitive behavior therapy or using cognitive behavioral approaches in the school. The communication and the social skills training definitely have had very positive results. Many of the children with Asperger's can learn the unwritten rules of socialization and communication when taught in an explicit and a rote fashion, much like the way students learn foreign languages, for example. So in working with them, using the understanding of unwritten rules of socialization, very rote-like fashion. Children with Asperger's may also learn how to speak in a more natural rhythm, as well as how to interpret communication techniques, such as gestures, eye contact, one's tone of voice, humor, and even sarcasm. So they can actually learn this through communication skills training. In terms of using cognitive behavioral approaches, students can also learn that many of the cognitive behavior approaches encompasses many techniques that are aimed at curbing problem behaviors, such as interrupting, which can seem to be because students with Asperger's are so rigid, they want to let you know, okay, I have something to say, and I'm going to tell you, and I'm going to get it up. So it seems as if they may be interrupting. Obsessions, meltdowns, angry outbursts, as well as developing skills like recognizing feelings and coping with anxiety. Counseling usually focuses on training the child to recognize those troublesome situations, such as if they're in a new place or there's something new that's happening at school where there may be lots of social demands, preparing them for a fire drill if that's going to take place, because that's something doesn't happen every day. So that's important. And then select a specific learned strategy to cope with that situation should a fire drill occur, even though they weren't expecting that. Some of the techniques in using this approach that can be used right in the school, cartooning, situation, options, consequences, choices, strategies, simulation strategy is another one. Cognitive behavior modification and self-reinforcement are techniques that can be used. In cartooning, what the counselor actually does is almost like create like a comic strip of a situation. And again, in knowing the student that you're working with, you learn some of the situations that are unique to this student. So putting it in cartoon type format, strip format, where they can understand, they can actually visualize it, help them to understand what would happen next. What do you think is going on with this person? What's the purpose? This helps to enhance the student's understanding of verbal and nonverbal language, so they can read the expression on the person's face. So if they're smiling, obviously it means the person is happy. If they're not smiling or frowning, it means they're unhappy or they could be angry. But helping them to read those nonverbal language is really important. Use figures and symbols in a comic book format to teach and practice conversation and nonverbal communication. And that's really the key in using cartooning, just using those symbols and those figures to teach and then to practice the verbal as well as nonverbal. And then the situation, options, consequences, choices, strategies, simulation strategy, or SOCCSS. Here is just setting up a situation and working through it, having a strategy to work through with the situation. Understand the situation by first identifying who was involved, what happened, the date, the time of the occurrence, the day of the occurrence, and the reason for the situation. Then the option would be to brainstorm several options for behavior. This step usually encourages the student to see more than one perspective and to realize that any one situation presents several behavioral options. In other words, this is helping them to understand those nonverbal cues that they have a difficult time with, but also understanding that, yes, they may have a fascination with a particular topic and they want to share about it. Another person that they're speaking to may have just as much knowledge. Give them an opportunity to speak as well and to know when that person needs to speak. And then the consequences, both student and counselor work together to evaluate each of the options generated. And choices, the student selects the option or options that will have the most desirable consequences. Again, thinking about the other person, taking on the perspective of the other person as well. In the strategy, the student and the counselor develops an action plan for implementing the selected option that they've chosen to take. So, for example, if the student shares with the counselor that they're a little bit anxious about going to the lunchroom, and they need to go purchase their lunch, how would they do this? So they would work through that using the SOCCSS approach. Simulation, role play the actual alternative, see what that's like. In terms of the cognitive behavior modification, this can be used to work with students for a variety of reasons, such as behavior changes. They're having a difficulty with behavior changes, following specific classroom rules, attending to assigned classroom tasks, such as schoolwork, tests, and homework. And reasons why this technique works, because it teaches students to monitor their own behavior or their performance, and then to deliver self-reinforcement at established intervals. So not only are they learning new behaviors, but they're also reinforcing those behaviors so that it can occur again. By doing this, the locus of control for the behavior is changed from a source such as the teacher or parent, and it's actually given to the student. This helps the student to take responsibility for his or her actions, thoughts, as well as their feelings. In terms of the systematic self-reinforcement, again, positive desired behavior is motivated and rewarded by those positive reinforcements. Can actually help in teaching and encouraging students to use positive social skills to complete their homework if they have a difficult time organizing and getting things done, as well as completing the school or classroom work that's needed. Now, I know we covered, we didn't really get into covering medication, but sometimes we've found that a lot of students who are diagnosed with Asperger's are actually on medication. So it's important for you to know that there are medications not specifically to assist with Asperger's, but some of the effects of it. For example, medication that's going to help with anxiety, that's going to help with depression or hyperactivity, seem to help students with Asperger's. So that's important for you to be aware of that. In terms of coping and support, as counselors, we really want to be able to help students with Asperger's as well as their parents to cope with it and provide as much support as we possibly can. Asperger's can be very difficult, lonely disorder for children and their parents. By nature, the disorder brings difficulties socializing and communicating with the students. It may also mean fewer play dates and birthday invitations, more stares at the grocery store, from people who do not understand that a child's meltdown is part of a disability and not the result of bad parenting. Having that support is real important. However, for this disorder, luckily, this disorder has actually gained widespread recognition and attention. There are more and more sources of help, not just for you as a counselor, but also for the parents and for the older students, because the older students with Asperger's can actually learn how to cope and how to live successfully with it. And Deanne's son is definitely a testament to that. And she probably will share with you a little bit towards the end about her son that I'm so very proud of. Here are some suggestions. Learn about the disorder. Just 30 years ago, pediatricians had never heard of it. It's only been in the United States for the past 20 years. So now there are numerous books, websites that are dedicated just to this disorder alone. You can always do some research so that you can better understand the students' challenges and the range of services in your school district and the state as well that can actually help or assist the child and the parent. Learn about the child. The signs and symptoms of Asperger's are different in every child, and young children have a hard time explaining their behaviors and challenges. Sometimes even older kids have a difficult time. But with time and patience, you learn which situations, which environments may cause problems for the child, which coping strategies will actually work. Keeping a diary, looking for patterns also helps. Advocate for finding a team of trusted professionals. Important decisions about the child's education and treatment will need to be made. Encourage parents to keep a team of teachers and therapists who can help evaluate the options in your area and explain the federal regulations regarding the child's disabilities or the children with disabilities. Help others help the child or the student. Most children with Asperger's have no visible signs of the disability, so you may need to alert other school personnel, such as coaches and other adults, to the child's special needs. For example, a well-meaning coach may spend time lecturing the child on looking at him or her while he or she is speaking to that child, something that's very, very difficult for a child with Asperger's to do. But if you alert the coach to this situation, some of the symptoms, some of the signs, then the coach will be more prepared in working with that student. Help the student turn his or her obsessions into a passion. And this brings in a little bit of career counseling. The tendency to fixate on a particular narrow topic is one of the hallmarks of Asperger's, and it can be annoying to those who must listen to their incessant talk about the topic every single day. So a consuming interest can also connect this child with Asperger's to their schoolwork, to their social activities. Some cases, kids with Asperger's can actually even turn their childhood fascination into a career or profession. So that's why I'm saying career counseling can come into play as well. So in terms of closing, and I know we kind of rushed through it, but we wanted to make sure we got all of the advocacy piece as well as the interventions, the counseling piece in as well. Recognizing and advocating for students with Asperger's, help them to succeed in the school setting. We know that, that's a proven fact, particularly in Deanne's case, and as well as other counselors in my experience that I've been working with have actually attested to. Working with students with Asperger's can be frustrating for everyone involved. For teachers who may find that these students difficult because although they have academic capacity to do their work, they often resist certain subjects or make classroom management difficult at times. For parents who may lack information on how to best help their child. For the students themselves who often display high levels of anxiety when faced with new challenges and resist change to their regular routine. School counselors, even for school counselors who work with teachers, parents, and students with Asperger's, they should expect to feel some level of frustration and challenge by the problems that are presented. However, through leadership, consultation, and collaboration, school counselors can definitely help to foster success for this growing group of students in our school. With that, we kind of want to wrap it up and give you opportunity to ask questions if you have any questions for us. We wanted to, like we said, we'll spend the first 40 minutes just kind of going over it and then give you a chance to ask the questions. So we'll wait for your questions if you have any.
While we're waiting for questions, too, I can add that, we have uploaded a poem that goes along with this presentation that says, "Welcome to Holland." And basically what it says is that, these parents are, we get these kids, and sometimes you think you're getting one thing, you think you're going to Italy, and all of a sudden you end up in Holland. And it can be a very traumatic experience. But as you go through it, you learn that, Holland can also be a very beautiful and wonderful place. You just have to learn how to, you just need to learn the things that Holland has to offer. And so in going through that, as you're working with parents, even not just parents with Asperger's, but parents of students with all kinds of disabilities, you have to understand that for them it's a grieving process.
Yes.
And the grief process, you don't just go through the stages and then you're done, as you all know. There are going to be days when it's just much more difficult than other days. There are going to be days when you're celebrating and days when you're crying. And so I think as school counselors, it's very important to understand that as a parent of a child with a disability, that there are going to be some days that are just much more difficult. And even as a teacher and a school counselor dealing with these kids, you got to cut yourself some slack sometimes, because like Dr. Rowland said, it's not always roses and cherries. It can be extremely difficult. So, dealing with that, it's just important to keep that in mind, that process of grief is ongoing, and sometimes you may be grieving, sometimes you may be, being enjoying those times. So that's just important to remember.
And in saying that, Deanne, it's important for us to know the resources that are out there, because parents who are going through the grieving process, there may be support groups that are out there with other parents who have gone through this that can kind of help them, and they can identify with them and help them understand. Sometimes parents just need to hear from other parents how they're handling it and what they're actually going through. I don't know if you'd like to share a little bit about where Damon is, your son is right now, and in terms of his education, how far he's actually come, and some of the goals.
Yeah, Asperger's is a developmental disorder. So these kids developmentally, they do learn to cope and learn strategies and, get better. So my son is now a senior. We're not exactly sure what he's going to do after high school, but like we said before, turning their fixation into a passion. He loves His thing is animals, and so he ultimately would like to work in a zoo with animals. So taking that fixation and turning it into a passion, is something that we're working on. But college can be a very difficult and stressful thing. And right now it's, breaking the routine of, how he's known school to be for the last, several years. So breaking that routine and changing the schedule can be very, very difficult. So that's also, as a high school counselor, a difficult time, to support parents and students through.
Okay, we do have a couple questions right now.
Okay.
Okay.
Okay, the first one is from Naomi, and her question is, what do you think is the most effective way in talking to parents about their child being diagnosed with Asperger's? As a counselor, I have a student who shows all the signs, but I don't know the best way to tell parents.
Typically, it depends on, I'm not sure of how the process works in your school, but, a lot of times now with RTI, students are having to go through that. So you'll have meetings with, teachers that you could sit on possibly with parents. And depending on how well the student is performing in school, you can always go through it in that way, through the academic process. And through that and RTI, often it's discovered through questionnaires and things, through a school psychologist sometimes, that may be a struggle. With the parent, I always suggest, just saying that, the child, whatever the struggle is, whatever you're seeing at school, just being very specific about the things that you're seeing at school. I've noticed that, he has difficulties getting along with others. This may be affecting him academically. I always bring it back to academics. And then, recommend, a consultation with a pediatrician and possibly a full psychoeducational evaluation. As you're speaking with the parent about it, you may be surprised and the parent is already thinking the same thing you're thinking. But, always keeping it at the school level, because we're not diagnosticians. At the school level, keeping it on academic, how it's affecting the child academically and socially, emotionally as a counselor.
And that's always the key, to always focus on the academics, the behaviors that we're actually seeing, as opposed to providing a label, because that will come from a clinician, that will come from a doctor.
Okay, the next question is from Amy, and her question is, does a student...
Jeff, can you speak a little louder? You're coming a little muffled. I'm sorry.
I apologize for that. Is that better?
Okay. Yes.
Okay. So Amy had the next question, and her question is, does a student who is diagnosed with Asperger's display signs of defiance when given academic material?
Show a sign of what? I'm sorry?
Defiance.
A defiance? Uh-huh.
When given academic material.
When given academic, okay.
Yes,
Absolutely.
Definitely they can, if it's not their, if that's not their interest, because they can be very narrow-minded and not want to do anything other than what they're completely interested in. So using those cognitive behavioral interventions like Dr. Rowland mentioned, as far as, maybe instigating some kind of reward system can often be helpful. But yes, they can be very defiant in completing their classwork. And one of the things we mentioned about it can be very frustrating working with the students. So figuring out what the student, what their interests are can help. and, trying to work out some kind of, I don't want to say deal with them, but something like that, so that, you can get them to do their work. Because often they are very capable, but getting them to produce that work can be very difficult. Often they struggle with fine motor skills, so getting them to write can be very difficult. You may need to work on something with a computer. If the child's receiving occupational therapy, that can be helpful, and they can often help you with lots of strategies for that student, because writing can be very difficult. So, like I said, unfortunately there's not just a set of rules and strategies that we can use for every child. You really kind of have to get to know the student, but using those cognitive behavioral skills can be helpful.
Yes, and having in place reward system is really important, where they can actually reward themselves, and it has to be something that they totally enjoy. Then that will help if they know, okay, here's something you have to get done. Once it's done, then you're able to do something, and then because you want them to be self-motivated, as opposed to you always having to prod them along.
Okay. The next question we have is from Clindell. Clindell says, "Good day. I have a student who has been diagnosed with Asperger's, but the parents refuse to accept the diagnosis. She asks for help in working with her child, but does not want to be educated about Asperger's. Do you have any suggestions on how I, as a school counselor, can help her accept her child's diagnosis? Do I just accept the fact that she's rejecting the diagnosis?"
Yes, that's a great question. Thank you. And that's one of the reasons I brought up that poem, Welcome to Holland, is because I believe as a school counselor, just simply, understanding what's going on can give you a lot of help with being an advocate. And sometimes, maybe what you need to do is just be patient and wait on that parent to come around. Because like I said, she was expecting to go to Italy.
Yeah.
And all of a sudden she ended up in Holland, and that can be a very uncomfortable place to be. Just in working with the parent, if you're able to have open conversations with her, always, just label the behaviors and speak specifically about academic difficulties and behavioral difficulties, social emotional things that are going on, and deal with those as they come up rather than putting a label on it. You know in your mind what's going on, but the parent has got to realize in their mind what is going on. And offering some of the suggestions we've talked about today for her, routines are so helpful, structure, and things like that. And hopefully she'll come around to understand and believe and see all of the wonderful, wonderful traits that her child has. But until then, I think, it's just important to be understanding and patient and know that, she's going through that grieving process and she's trying to figure it out. So hopefully, she'll come to the conclusion sooner rather than later.
Right.
But offering support and assistance for specific behaviors can be helpful.
And avoid the labels. Just try not to use it at all, because obviously it's not a pleasant one for the parent who does not want to accept that.
Okay.
Any other questions?
There's one more question right now, and it's from Amy again.
Okay.
And her question is,
okay.
How young are children diagnosed with Asperger's?
How young are children diagnosed? They can be diagnosed as young as school age.
And preschool.
Preschool age. Yeah, it's usually not any earlier than that. So I would say about 2 or 3. And again, that's a little bit early. So you may see the diagnosis from around Pre-K?
Oftentimes, the first diagnosis is pervasive developmental disorder, PDD. That's often the first diagnosis that's given. And then, as they get more information and as the child is observed more by more people, teachers, school counselors, parents, pediatricians, they can get a more accurate diagnosis. Sometimes kids at that age don't just fit into a specific category. It's sometimes difficult to diagnose.
Okay, we're getting another question, once again from Lindell.
Okay.
And I apologize if I'm saying that name wrong. But should all students who have been diagnosed with Asperger's have an IEP, even if they're coping well in school without lots of support? Should it be put in place just in case they need support or intervention?
That's a great question, and I know nowadays with new regulations, sometimes without academic deficits, it's difficult to even get an IEP.
Mm-hmm.
Not all, a lot of students with Asperger's, especially in elementary school, will function very well and don't need an IEP.
Right.
Although, hopefully the parent is getting some outside support, because oftentimes if it's not just language, the pragmatics of speech can be taught by a speech therapist much more efficiently. They're so skilled in that that can be really, really helpful at an early age for those kids. So, speech therapy, especially if nothing else, can be extremely helpful for the pragmatics of language and speech, even if it's not actually articulation or anything like that. So that can be really helpful. Do they have to have one? Definitely not. Could it be helpful and beneficial? Yes. Like I said before, even for occupational therapy, because of the fine motor skills, and often large motor skills also are impeded. And so, but sometimes parents can get those kinds of services outside of the building. I will say, though, even if it's not necessary, in testing accommodations, smaller groups, because of the sensory stuff going on and the needing breaks, that can be helpful. Also, but middle school
Definitely
can, like I said before, and it's well documented in literature, that at the middle school level, these kids sometimes really hit a wall. So if it's not, maybe they just don't really need an IEP in elementary school. There's no reason to put one in place if it's not necessary. But at the middle school level, oftentimes, maybe just kind of warn parents, or that can be, you may see some more struggles and just be ready for that. So it sometimes can become an important piece of their academic plan.
So really and truly, there should be one put in place just in case. Make sure you cover all your bases. But if the parent is not requesting one, not pushing for one, you can't, you can't make them do it, push for one.
Yes, and it may be difficult to go do it just in a school without academic difficulty.
Right.
Okay, if there's no other questions, I'd like to thank everyone for joining us today. And, of course, thank our two presenters, Deanne and Karen, for their great work. If anyone has any additional questions, I'm sure they'd be more than willing to receive them. And you can email me with those questions, and I can gladly forward them on. Or I'm not sure if you guys left your email addresses anywhere, but I'm I'm sure that we can find a way to get questions to you.
Actually, we haven't, but we can get those. You can get it to them.
Okay.
Yeah, I'm more than happy to answer any questions anytime.
Okay. Well, thank you for joining us, and we look forward to seeing you on more of the ASCA webinars.
Thank you
very
so much.
much.